I think we can get started. So good afternoon, everyone, and thank you for joining us today. My name is AMR de Frutos. I'm a policy manager at IFA, and on behalf of the European Public Health Alliance, I am delighted to welcome you to this webinar. For those of you who might be less familiar with IFA, we're Europe's leading civil society alliance working to improve public health and reduce health inequities. Antimicrobial resistance has been a core part of IFA's work for many years, and we are pleased to continue supporting discussions and bring evidence, practice, and policy together. Before we begin, just a few quick practical notes from our team. Your cameras and microphones are switched off by default. This session is being recorded, and the recording will be made available afterwards. You can check it on our website. You can send questions at any time via the Q&A function that you will find under the More button. You can upvote questions that you think are more relevant, even if they come from other participants, but commenting is disabled. Our moderator will bring selected questions to the panel during the discussion, so that's why it's important that if you see someone else's question that you think is also very relevant, please vote for it so that we can prioritize it. And if you encounter any technical issues during the webinar, please feel free to message us directly. To guide our discussion today, we're joined by Dr. Bruno González-Thorn, who is full professor at University Complutense of Madrid and who serves as expert advisor for IFA, bringing substantial knowledge and insight into antimicrobial resistance and public health policy. With that said, over to you, Bruno.
Okay, hello everyone. Thank you very much for being with us today. Last week we had a lot of action related to the World Antimicrobial Awareness Week, but this we decided to do this event today because now you are a bit more relaxed from all the super activities from last week. So I think we are ready to have this activity today, which is a joint activity between IFA that Haisal just mentioned and Una Europa. So what is Una Europa? Una Europa is an alliance of universities. In Europe, we are stopping slowly to work in single universities. And since 2019, we're working in alliances. So the European Union Commission launched a call for organizing alliances, and we organized this Una Europa Alliance. We are 11 universities. So it's Madrid, Edinburgh, Dublin, Sorbonne in Paris, Leiden, KU Leuven, Bologna, the oldest universities in Europe, 1088, Jagiellonian, Freie Universität Berlin, and Complutense University here. So, and one of our main activities is One Health. So currently I'm the chair of this One Health, this Una Europa Alliance, where we have a lot of academic and research experts and also public health experts also working in this area. So, for example, I could have invited Annemarie Heikenheimer from the University of Helsinki, that I forgot, by the way, or Alessandra Di Cesare. They are both experts in antimicrobial resistance in food transmission. But this time, and we decided to have this panel with Jorge Mateo from the WHO, then Ernesto Líbana from EFSA, then Azucena Mora from the Spanish Agency for Food Protection, and also from she's also a member from another alliance, and also and then Vanes, who is head of the data analyst unit, the antimicrobial consumption and resistance in animals. So we will have this 15 minutes talks. So I think the 15 is fine. And like this, we can have then a final discussion afterwards. In total, we will be together like 1.5 hours. I wanted to thank some people that made this possible. So obviously Milka, who is working who is leading the Milka Sokolovic, the European Public Health Association, but also the cross-agency task force of the European Commission. We are working in Europa with them. So this is the ECDC, EFSA, EMA, the European Environmental Agency and the Chemical Agency. They have like a task force that they are working with us together. So thank you very much for joining us. And I also wanted to welcome the North American One Health Network. We are working at this One Health Network in Europe together with the North American One Health Network. So Tracy from the University of Colorado, thanks for joining. Because I think that in this One Health concept, we also have to work together also with other continents. And also in Una Europa, we're working together with African universities. So welcome also, because we spread this webinar this continent and also to the Latin American continent, where we are working together with many different universities. So welcome to all of you. The next step will be Asian universities, and then like that will be together. So as you know, antimicrobial resistance is the most important health problem in the world. We know it very well. Probably by 2050, 39 million people will die per year on antimicrobial resistance only. And today we have calculated that 1.2 million people die of antimicrobial resistant bacteria. Because of antimicrobial resistance. So not associated with resistant bacteria, but because of antibiotic resistance. And obviously, this is a One Health problem. One Health means, for those of you that you don't know very well, means that the health of humans and the health of animals and the health of the environment is completely interdependent. And in this sense, I think the webinar of today is of special interest, where there is probably not the single one, but probably there is an effect that we'll see it, of the food and transmission from food and transmission from animals directly, also through bacteria directly, or through mobile genetic elements that can make also the problem of antimicrobial resistance in humans worse. Don't forget that in the problem of One Health, when it was created like 15 years ago, we were saying that One Health is like resistance is coming from animals. This is not anymore the case. One Health is really much broader spectrum, and we are talking about One Health when we are working together, taking these scenarios into consideration, including all disciplines. So in these last years, we're including not only health science, but also human science. So there's a lot of behavioral science, and maybe we are going to talk about today about it. Behavioral science, social science, anthropology. There's a self-medication in Spain, which is much larger than in Sweden. Why? This is related to the behavior of people. Why do we prescribe differently in one country and another? So we are embracing, especially in Una Europa One Health, also social sciences, because we think that they have to be on board if we want really to tackle antimicrobial resistance. And with no further delay, it's really a pleasure to have all these friends together that in a very short period of time, they really agreed to be here today with us. So thanks a lot, Jorge, Ernesto, Azucena, and Vanes for accepting this invitation that it was just a couple of weeks ago, and for making the slot available. So I think that we are ready. If there's no any questions or comments, and thank you, Heisel, also for organizing this together with me. Thanks. So I think with no further delay, Jorge, I think the floor is yours. You can break the session and start with your 15 minutes. Remember to be here together with us. Thank you, Jorge, for joining us.
Thank you very much, Bruno, for the introduction and for the opportunity to present. In my presentation, I will focus on an overview of the global efforts to address One Health AMR. Next, please. So I will start with the definition on One Health that was adopted in 2021. And One Health is defined as an integrated, unifying approach. This approach recognizes the health of humans, animals, plants, and the environment are closely linked and interdependent. And also this approach mobilizes multiple sectors, disciplines, and communities. So this is one of the main challenges that we are trying to address in all countries. And this is to work together to contribute to make sustainable development and address AMR. In this case, AMR. Next, please. So, all of us know that we need and use antimicrobials in the different sectors in human health, animal health, and aquaculture. And this AMR that has been developed due to the use of these antimicrobials is impacting the environment. Next, please. But in the last WHO bacterial priority pathogen list, we find some common bacteria that is circulating and transmitting in the different sectors. So you can see here that considering the high group in the priority group, we have Salmonella, Enterococcus, Staph aureus, they are considered as in the group of high priority, but also we have in the critical group, the most important group, an E. coli, which is in the group of Enterobacterales, resistant to third-generation cephalosporins, but also resistant to carbapenems. But this is important because E. coli is one of the bacteria that can share this resistant mechanism and other resistant mechanisms among other gram-negative, including the ones that I mentioned and are common in the different sectors. And we also know that we use antimicrobials, some specific in humans, some other are used in both sectors, in humans and animals, and also in plants. And there are antimicrobials that are only used in animals. Next, please. So to address these One Health aspects, and here I'm not just talking about AMR, the four organizations established this quadripartite collaboration. So now when we talk about One Health, at global level, we are talking about these four organizations: the Food and Agriculture Organization of United Nations, which mandate is on agriculture, the UN Environment Program, which the mandate is environment, WHO and the human health, and the World Organization for Animal Health. But additional to this quadripartite collaboration, it was established the quadripartite joint secretariat specifically to address AMR activities. Next, please. So we have political frameworks and guidance to address and support countries in the implementation of national action plans. First, we have the Global Action Plan that was launched in 2015. And this year is in the revision process and will be updated and launched next year. We also have the report of the Interagency Coordination Group that was established after the first UNGA declaration in 2016. This report was launched in 2019 with the specific recommendations on how to support countries in the implementation of national action plans. The quadripartite also established and developed this strategic framework and was published in 2022. And last, the report on One Health, the One Health Joint Plan of Action in 2022, which include one action track specifically on antimicrobial resistance. Last year, we had the UNGA political declaration with 44 commitments that we are addressing now and supporting countries to address this AMR problem. Next, please. At the moment, the quadripartite joint secretariat on AMR, we have developed different documents, guidance to support countries on the responsible use of antimicrobials in non-human sectors, the One Health AMR research agenda, the One Health AMR legislation. This is an assessment tool to identify gaps on legislation to address AMR. And the last, which will be published soon, the One Health Integrated Surveillance of AMR and AMU. All of them are also included in the UNGA political declaration, but it's important to mention here that it's still needed to enhance the collaboration, cooperation, and partnership with different institutions around the world to support the implementation of these documents. Next, please. FAO also is working in this initiative that is called Renofarm. Basically is to reduce the need of antimicrobials on farms. And Renofarm is guided for 5Gs, the good health services, good production practices, good alternatives, and good incentives, and good connection. Next, please. This is the status. This is just to share what is the status of countries implementing national action plan, but specifically here is the level of how countries are establishing this multi-sectoral coordination group to address One Health AMR. So in the picture, you see that the ideal scenario is in dark green, and the less advanced or developed or establishment of this multi-sector coordination group is in red. So you see that in the last 9 years, there are some advances, but it's still critical to establish these coordination groups in the countries to address One Health AMR. Next, please. And in the last report was launched some weeks ago, we see that only 46% of the countries have include all sectors in this multi-sectoral coordination mechanism. Next, please. This is the WHO medical important antimicrobial list that was updated last year. And this list analyzed all classes of antimicrobials and has grouped in two groups the medical important antimicrobial. Those classes of antimicrobials that are only used in humans, for example, carbapenems, and those that are more critical because are used in animals and in humans. So in this case, we apply some criterion and prioritization factors, and then we have the different categories, from the important antimicrobials to highly important antimicrobials, critical important, and the highest priority critical important antimicrobials that are those antimicrobials that are critical to treat serious infections in humans. So that's why is the recommendation to use in a responsible way in non-human sectors. Next, please. In the last report of the World Organization for Animal Health that was launched in May this year, we can see that there are still some countries using this highest priority critical important antimicrobial. We see here fosfomycin, fluoroquinolones in the case of enrofloxacin, and still colistin are used as a growth promoters. So this is something that is recommended not to use and avoid the use of antimicrobials for growth promotion. Next, please. Thank you. And this is also the report. What is the classes of antimicrobials that are most used in the animal health sector? In the graph in green, you can see that the most common classes are tetracycline, penicillins, and macrolides. And this is from the different species reported by 71 participants in this report. In blue, you can see the antimicrobial used in food, in aquatic food producing animals. But you can see here that the antimicrobials that are used are different. In this case, the most common are amphenicols, tetracyclines. But importantly here is that is a lot of use of fluoroquinolones and aminoglycosides. And you can see on the right side the number of countries that at this moment are reporting data on use of antimicrobials in these aquatic sectors. Next, please. This is just to share that the different organization has established specific platforms to collect data. In the case of WHO has developed the GLASS, which is the Global Antimicrobial Surveillance System, collecting data on AMR and AMU in human health. Animus is the platform from the World Organization for Animal Health, and they are collecting data on AMU in animals. And FAO launched the platform last year, and they are collecting data on AMR in animals and food, and also they are going to start to collect data on AMU in plant production. In the environment health, UNEP is now working to develop the platform to collect data on AMR and residues in the environment. Next, please. Sorry, can you go back to the previous one? Just to mention that this is the platform per sector, but now we are working in a new platform that is linked with this different platform for each organization to establish the first global integrated surveillance system on AMR, putting together all this information and help countries to analyze data from the different sectors, in the sense that the idea is that countries will establish this One Health integrated surveillance system on AMR and AMU. Next, please. This is the last one, just to share with you that this is the last guidance that will be launched soon. It's the One Health integrated surveillance of AMR and AMU. This guidance is the result of different global guidance that has been developed in the past. We include here the IGSR guidance on integrated surveillance in the food chain, the Codex Compendium of standards and codes on antimicrobial use, the focus would on One Health, also the terrestrial and aquatic codes from the World Organization for Animal Health, and also the WHO model of integrated surveillance called the Tricycle Project. Next, please. Thank you very much. And over to you, Bruno.
Thank you very much. If everyone is so disciplined as you, I think we can be very happy today. Thank you. Thank you, Jorge. So that gives me a bit of time to maybe to start with a question. When we talk about the integrated surveillance about humans, animals, etc., we are putting together data from different systems, but these different systems are not really collected the same way. What do you? Because if I'm not wrong, we are changing like data from diseases in humans. On the other hand, in animals, we tend more to take surveillance data from healthy animals in the abattoir. So what do you think? How do you tackle this? Or what do you think about taking different bacteria from different places? There may be like different resistance levels in pathogenic bacteria or commensal bacteria. How do you think? Do you think it's important or not? Or we just take what we have and we'll continue? What do you think about this?
Yeah, definitely. It's a good question. Thank you, Bruno, because exactly this is what we are trying to do, how to harmonize the indicators to compare the data at the end. So that's why I mentioned this GISA platform that is exactly trying to how we are going to collect and which information we need from glass. And also because in the case of AMR, we have different pathogens that are focused on human diseases in the human health sector. But what exactly is the information that we need to compare with the animal health sector, and also not only AMR, but also AMU. So in this case, we need to, if we just focus on the pathogens in the animal health sector that is affecting human health, we need to also see how countries are addressing foodborne diseases, for example. So this is part of GLASS, but we need to develop more to really compare with this system that InFarm is now establishing in countries, because the main focus in InFarm now is only AMR in healthy animals. This is for one side. For the AMU component, we are also working with how to establish the best harmonization to compare AMU in humans and AMU in animals. This is something that I can mention this because it's important. We are gaining a lot of experience that the European Union has done on these aspects. And this is what we are taking similar approaches to have these global approaches to include and implement in the different countries. Over.
Okay, thank you very much, Jorge. It was very interesting. Okay, so with this, I think we can continue. I didn't introduce you, Jorge. Sorry, you are Science and Governance Coordination and Monitoring Unit, AMR Department, WHO. Sorry, Jorge.
No
Gracias. So our next speaker will be Ernesto Liébana. He's the biohazard team leader at the European Food Safety Authority. Hello, Ernesto.
Hello. Thank you, Bruno, and thank you for the invitation to be here and share with you some of the work we do in EFSA to support One Health AMR. So if you move to the next, please. Yes, so I will be just trying to give you some examples basically on our monitoring and surveillance activities and also some of the risk assessments. Next. In keeping with the One Health theme, I don't need to go back here and repeat the definition, but I think the terms transdisciplinary across domains and across tiers are very, very important for us. And in the European Union in general, we have now mechanisms to ensure that we not only talk about One Health, but we make it real. So at the level of Santé, there is a task force, One Health network that invites routinely competent authorities and representatives from the public health, from the animal health, and from the environmental sector. We have an action plan, which is labeled as One Health. And the most recent activity here is an interagency working group on AMR, where the five sister agencies, EFSA, ECDC, EMA, ECHA, and EA, work together, because more and more we receive questions that we have to tackle together in joint opinions and joint reports. Next, please. So there is one flagship activity that we have every year, which is the production of the EU summary report on antimicrobial resistance. This is something we do together with our colleagues in the European Centers for Disease Control and Prevention, and is where we present all the data on surveillance of AMR in healthy animals, in foods, and then in humans. And this is very much about foodborne zoonotic bacteria and indicator bacteria. So there, what we aim to is to provide prevalence data, but also to do trend analysis, and as far as possible also to have our eyes very open to emerging signals. Next. One of the things we try to do is to encompass all this complexity of data into succinct indicators. And for us, in our domain, we have two main indicators. One is this complete susceptibility in E. coli. And as you can see from the data here, we have marked variations in different reporting countries. Here, what you want to see is high levels. The higher the bar, the better the situation in a given member state. And we have very diverse. The good news is that we had, over the last 4 or 5 years, a statistically significant increase in trends in this particular indicator. And we went from 6 years ago, 5 years ago, 25% of the reporting countries having a positive trend, an increasing trend. And this has been growing over and over the last few years. The trend has stopped. It is a bit slower. And we are keeping a close eye to that because it's a bit worrying. So we will see what happens in the report this year. Next, please. The second indicator, a key outcome indicator we have, is prevalence of ESBLs or AMC-producing E. coli. Here, what you want to see is a low number. And we have the same situation, marked variations amongst reporting countries. And we have seen here statistically significant decrease in trends, meaning that the situation is getting better and better also for a number of years, going up to 70%, 77% of the member states having a decreasing trend. Again, last year we observed a hold in this positive trend, and we don't know exactly what's going on. So we watch with interest what is happening this year. Next, please. And what I said also is that we are having a very attentive eye to detecting emerging signals. And I will just talk a bit about the example of carbapenem resistance in Enterobacteriaceae in the food chain. Next. And back in 2011, there was the first occurrence of one of these bacteria in animals in Germany. And since then, there was an opinion published at the time by EFSA. And we decided this year to do an update of the situation. So there was an opinion of the biohazard panel where we covered extensively the current status, the transmission dynamics, methods in use, and also the contingency and mitigation plans. Next, please. And you can see here in this graph, very graphically, that from 2011 up to nowadays, the number of different enzymes that have been found in food production animals or foods has dramatically increased. Although these numbers are still low compared to resistance to other substances, we have really seen an increase in the number of reports, and especially in the pig sector, and driven by situations in certain countries, such as OXA 108 in Italy and OXA 48, as well as a number of other enzymes in Spain and Portugal. Next, please. You can see that the map of Europe is becoming more and more tainted, and there are a few countries that remain free from this observation. This year we had another couple of member states on top of the ones you see here becoming positive. So far, we have 14 EU EFTA countries in which this has been found. And as I mentioned, pig production seems to be the main problem in this particular aspect. Next, please. In the same opinion, we provided some recommendations about monitoring additional sources like aquaculture products, food of non-animal origin, monitoring additional bacteria which are not in our harmonized monitoring, such as Klebsiella, for example. We have also recommended to perform a number of investigations, traceforward and traceback investigations, and improve the detection methods. And how are we doing that? Next. So we put some money on the table, and there is a large grant, a monopoly grant funded by EFSA and coordinated by DTU. And right now they are in almost the second year, and they are conducting the detailed epidemiological studies to try to find out why they got these CPEs in their food production and possibly how this is spreading and what can they do about it. So what's the space? And we hope to have good results from this project that we will then translate into further recommendations in another opinion. Next. We are also very attentive to provide access to the data we produce. So we have been doing an intensive effort into creating database tools, story maps, as well as dashboards, because we realize that the reports are sometimes a bit dry and arid. It's difficult to read them. And you have to give the user the possibility to just experiment and search and mine the data we have available. So I invite you to go to our webpage and play a bit with all these tools which are at your disposal. Next. I mentioned that we work together with other agencies, and one of the prime examples for that is the work we do with EMA, and that is putting together the data on consumption in animals. SBAC for a very long time was the flagship project on consumption in food produced in animals. Now they have a different system that is quite young, and they produced the first report recently. Next, please. But for a number of years, we have been producing these DIACRA reports, these integrated reports where there is analysis done and trying to correlate the data on use and the data on resistance, bringing together data not only from animals, but also from humans with ECDC. And this report is now very well known. We have produced 4 of them, and the 5th report will come at the end of next year. Next. Also, as it was mentioned by Bruno, the way we do now, the monitoring is focusing on healthy animals and indicator bacteria, but we cannot forget that resistance is primarily a problem for treatment, and there is quite logically also an interest in knowing what's going on in veterinary pathogens. So there were a number of opinions, in this case from the Animal Health and Welfare Panel, doing a priority ranking of the combinations of bacteria and resistance for different animal species, and applying the animal health law criteria to see if they would be listed for monitoring activities. The result of that, because of the criteria in that law, are not that well geared towards AMR. They are more for the big epidemic diseases such as avian influenza, etc., was of uncertainty. So EFSA was not tasked to do this particular exercise. However, next, please. We found a way of collaborating with EU RAMRA, the JAMRA in this case, and with EARSVET, and we are really supportive of their endeavors to really put together a system in parallel to what we do for foodborne pathogens. And I have to say I'm very impressed by what they've done, and soon they will come up with the first report on resistance in veterinary pathogens. So that closes the gap that we were having on this type of data. Next. Going to the environment, we realized how important also this compartment is and how neglected it has been. We produced an opinion already 4 years ago on that. And in that particular opinion, the issue of water was identified as one of the closest to the food production chain. Next, please. And as a result of that, we put again some funds on the table for this project that we call Water Resist, in which we are trying to investigate together with partners the effect of using reclaimed and reused water in irrigation and processing of food of non-animal origin. Very interesting results also about the potential treatments that can be there to minimize the risk of a spread of resistance by this route. And this project will continue next year and we'll start yielding some results in the public domain then. Next. Last but not least, this is not only about antibacterials. Quite recently, there has been a lot of emphasis also on the problem of resistance to antifungals. And for the first time ever, there was a risk assessment done by EFSA, CDC, ECA, EEA, EMA, and the Joint Research Center. It took us 2 years. It was a very comprehensive result. And this case, it was centered around the use of azoles as plant protection products, but also as human medicines, as biocidal products for treating wood, as industrial chemicals. So the use is very wide. Next, please. And in this report, we tackled many things like resistance mechanisms, epidemiology, identification of environmental hotspots, and prevention and control options, as well as giving some hints to applicants on what they have to provide when they want to bring to the market new substances. So I invite you, it's a very comprehensive report if you are interested or if you want to start in this world of antifungal resistance. Next. And this is the last one I have for today. We also don't forget that resistance is not only important for animal health, but it's also important for plant health. And although in Europe it is not allowed to use these substances unless there are special derogations in some countries, but these are very rare. We also funded a little project here to take a stock of antibiotic use for control of plant pathogenic bacteria globally in the world, as well as doing a review of antibiotic resistance in this type of bacteria, and then ending up with a review of alternatives and innovative treatments. All of this was kind of spanning from the issue of Shigella and the difficulties in controlling such a disease in olive trees. And I think this report was again a very good example of a One Health element that was missing and is adding to the whole picture. Next, please. And just to end up, just by putting the emphasis on how important it is to improve communication, education, and stakeholder engagement. It was also mentioned before, the importance of social sciences. And we do in EFSA quite a lot of efforts in trying really to put all these messages out through the use of many different tools, podcasts, storytelling, little videos, social science, reports, Eurobarometer. So our colleagues in the communication department are really busy with us and they're very supportive. So again, if you go to our website, you will find plenty of these materials there that are useful for your information or use in other domains. And next. And with that, you have all the links where to find all this information here, and I'll be happy to discuss any questions or doubts you may have. Thank you.
Thank you very much, Ernesto. Now I think that everybody understands why in the last ECMID I dare to say we have the best food safety agency in the world, and that is the EFSA, because the amount of projects and things that you are doing are really amazing. I still have some questions, but as we did exactly 15 minutes, I think we can leave them, Ernesto, if you don't mind, for later on. So I give the floor then to the next speaker. So she's Azucena Mora, full professor of microbiology at the University of Santiago de Compostela, so northwest Spain, and member of the scientific committee of the Spanish Food Safety Agency. So Azucena, thanks for accepting the invitation, and the floor is yours. You also form part of the European Alliance. Okay.
Yes.
Sorry. Go, please.
Good afternoon, Bruno. Thank you very much. It's a pleasure to be here. So many thanks to IFA, to Una Europa Alliance, and to you, Bruno González-Zorn. Following the valuable insights from WHO and EFSA colleagues, I will now focus on a national experience, and I'll take you on a journey from farm to fork to demonstrate through my work how AMR connects animal, food, and humans. Next, please. Following the discussion on EFSA's crucial role from Ernesto, I want to highlight the role of national agencies, in this case specifically from AFSAN, the Spanish Agency for Food Safety and Nutrition. AESAN not only promotes safe food and sustainable production, but also acts as the primary link between Spain and EFSA through its focal point and other international authorities and institutions. And this ensures a coordinated European response and strengthens our scientific exchange. Next, please. And one of AESAN's most critical role is managing food safety alerts. It links the national CIRI system with the European RAST network, and this robust system operates 24/7, guaranteeing rapid communication and coordinated international response whenever a risk emerges. Next, please. Furthermore, AESAN coordinates official control through the national plan, making AMR surveillance in foodborne agents and monitoring veterinary medicines a strategic objective. AESAN is thus crucial to the European One Health monitoring framework by contributing national and joint AMR reports with EFSA and ECDC. Next, please. I must also highlight the scientific committee, where 20 experts of different areas provide the scientific advice that directly supports AESAN activities. All our reports are publicly available, not only through the AESAN's journal, but also through Food Risk Assess Europe. Next, please. So national agencies, European authorities, and food safety experts, we are all deeply concerned about AMR. AMR threatens, as we have heard before, threatens food safety, sustainable food production, and the farm-to-fork strategy, which is at the heart of the Green Deal, and achieving the 50% mandatory reduction target for animal antimicrobials by 2030 is challenging, but we are all committed. This leads me to my own little contribution. In this second part of my talk, I'll share my experience in tracing this threat. Next, please. So to start, I need or not to explain two things. Firstly, why focus on E. coli? I think that Jorge and Ernesto have already explained very well it, simply because it's the ultimate sentinel organism. It moves through all One Health compartments, remains a critical WHO priority pathogen. Those strains, third-generation cephalosporin and carbapenem resistant, and causes significant foodborne infection and economical losses. Well, I have to confess at this moment also that I'm a little in love with E. coli after all these years with this bacteria. Next, please. And I have also to explain why a focus on urinary tract infections. And this is due to the severe burden of AMR. We have heard the global figures, but UTIs are among the most frequent multi-tract infections, causing circa 260,000 deaths globally, with E. coli and Klebsiella pneumoniae responsible for over half. And if I come to my place, look there, from a recent multi-center study, we learned that in Spain, superbugs kill 20 times more people than traffic accidents, over 20,000 per year. This is something that we always explain to our audience in Spain. And keep in mind these key points. UTIs are a top cause of multi-drug-resistant deaths, and ESBL producing E. coli is the main culprit. Next, please. In summary, driven by the sentinel role of E. coli and the burden of UTIs, my research evolved from my initial interest on cigatoxin producing E. coli, STEC, but after some years studying this pathogen, this pathotype of E. coli, my mind quickly broadened after observing that STEC with a simple example. I observed that the STEC presence not only in the male reservoir ruminants, but also linked to wildlife. Next, please. And as SPEC, the extraintestinal pathogenic E. coli, and AMR became a primary concern, they also became a target for me. In parallel, we expanded our toolbox to include genomics in the lab routine, which meant for all the scientific world a before and after in research and in lab surveillance. And all together led to striking findings. For example, I show here only one example. Suddenly we detected, well, not suddenly, after years of diagnosis and surveillance, we detected an unusual hybrid ESBL E. coli clone in wildlife, in foxes, in human patients of our health area with diarrhea, and meat, different kind, pork, chicken, beef. Genomics confirmed the isolates were highly similar, almost identical. And the most surprising thing is that it was not only circulating across our health area. We could find out that it was in different countries, including UK. So one clone moving through different hosts, different foods, even different countries. Next, please. So the new findings reinforce our new perspective. Food is the One Health link par excellence. Why? Because reveals what happens on the farm, at the slaughter, at retail, and ultimately for the consumer. Okay, here at this moment, our goal became developing a comprehensive laboratory method to detect multi-drug-resistant Enterobacteriaceae in food, combining selective media and key genetic targets for an integrated risk assessment. Next, please. And going further, we compared animal and food isolates with hospital and community UTI strains using different approaches, genomics and also in vitro assays. And our preliminary results strongly supported the food UTI connection. And we are now extending this work to in vivo models with the aim to identify shared intervention points. Next, please. So at this point, let me share a few things that perhaps explain some issues explained by Ernesto or posed by Ernesto regarding pig farming. I reported these findings in the SMIC 2024 with very good news. The Spanish colistin reduction program led to an impressively rapid decrease in MCR linked colistin resistance due to the near total reduction in colistin consumption that nowadays is close to 100% reduction. So in our studies, we found from the decrease from 77% in pathogenic isolates to 19% also in pathogenic, and down to 0% in commensal E. coli. But this success did not extend to ESBL producers or general multidrug profiles. I think that the message is clear, as we heard before. Continuous integrated AMR surveillance is essential to know what is going on. Next, please. Recent diagnosis data confirms the continued downward trend in colistin resistance, again, a great achievement. However, the number of ESBL producing E. coli keeps rising. So we say, this is a reminder that antimicrobial resistance never stands still. Next, please. Okay, and here was something that we discovered. This worrying novelty. We started detecting an increasing number of deaths in pig farming linked to extraintestinal E. coli in different production stages with different, as you say here, clinics science. The diversity is striking in terms of hybrid pathotypes, and with 65% being multidrug resistant and 8.5 being resistant to extended spectrum cephalosporins. So from a food safety perspective, this requires extreme caution and further investigation into these potential emerging strains. I have to say that we are still recovering them in our diagnosis service. So next, please. All the knowledge I mentioned gained over these years and the urgent need to tackle AMR in food led me to launch this project, searching by indicators for AMR surveillance and interventions under a One Health perspective, supported by the Spanish National Plan on Antibiotic Resistance as a top research initiative on AMR. The goal is to use a simplified key element-based surveillance system to guide intervention from farm to fork. So this is a One Health approach combining classical microbiology, whole genome sequencing, in vitro and in vivo models to track WHO critical pathogens, those mentioned before, specifically E. coli and Klebsiella pneumoniae across animal, game foods, UTIs, wastewater, and wildlife. Next, please. Just to mention that our key finding confirms that high-risk lineage are popping up across multiple compartments from hospital and pets to wildlife, wastewater, and food. This is highly promising because it proves that the effective intervention should be not sector-specific, expected that an action in one sector positively affects them all. Next, please. And my final take-home message is simple. To tackle AMR, we need a transversal integrated strategy built on 5 strategic pillars: surveillance, harmonization, prevention, alternatives, and communication education, just as we are doing today. Well, I have to confess, I am not claiming this is something new or on my own. This is the universal recommendation of all the key authorities as we have listened today. Priorities for humanity like AMR, not only AMR, but this priority is the issue today, can only be successful tackled from a genuine One Health perspective. And thank you very much, Bruno. The floor is yours.
You can finish the sentence, Lucena. You can.
This message, this last, is to be read, not to From the farm to the fork, antimicrobial resistance connects animal, food, and people. Safeguarding one means protecting all. Thank you, Bruno.
Thank you. Thank you. Thank you. Thank you. Okay, thank you very much. I have several questions, but I think that we will stop here. We'll leave the questions afterwards. You said some things about the link between food and urinary tract infections. I don't know if this is this particular thing or how universal this is. This is quite astonishing. It's still one in food. So a bit more specific than but I think scientifically extremely interesting. Thanks a lot. And so the last talk will be by Vanessa. I say it properly, Vanessa van der Hagen, head of the data analysis unit at antimicrobial consumption and resistance in animals. So Vanessa, the floor is yours. Thanks for being with us today. Thank you.
Thank you, Bruno, and thank you to the organizers for inviting me here and allowing me to tell you a bit about some of the aspects actually of the Belgian approach to tackle the problem of AMR in animals. The next slide, please. Well, and immediately the next. As said, I'm the head of the Data Science and Analysis Unit of AMCRA. Maybe just to introduce to you AMCRA, you can see at the bottom of the slide, we are the Center of Expertise on Antimicrobial Consumption and Resistance in Animals, Belgium. And we are a non-profit organization founded in 2012. And in the structure of our organization, you can really see that in Belgium, we have a mix of all the relevant stakeholders, let's say, and tackling the AMR problem in animals. So in our board of directors, we group scientists with 2 universities, veterinary sciences, the veterinary science division of the universities included. We have some veterinary organizations. We have the main farmer organizations in Belgium, and you also have the industry. So that's our board of directors. And then we also have the steering committee, where we have several governmental organizations combined. The Food Agency, the Medicines Agency, the Health Agency, and then we also have a National Health Institute, both animal and human health. I'm not going to talk about the specific roles of these 2 structural elements, but just to show you that really we are all together in Belgium, and that's actually the main focus. Next slide, please. At the basis, let's say, the approach in Belgium is really a bottom-up approach, where AMCRA, I think, plays a central role. Since the start, we have been focusing on sensibilization, communication about the problem of AMR, and of course also the vital role that antimicrobial use, AMU, plays in that problem. We have providing advices both to people from the sector, farmers, veterinarians, and so on, but also to the government, to policy organizations. And we have done that mostly by organizing technical working groups, in which we have science-based, we work at the basic from a scientific basis, but then we also discuss that and the broader group. And in the end, what we have is that we have policy. We try to have policy that is supported by the different stakeholders involved. And because we believe that that is the best way, let's say, to achieve results in Belgium. And maybe to illustrate that all the partners really in Belgium play a role, I would like to focus a little bit on the collection of antimicrobial use data in Belgium. For example, we have several organizations that do private data collection for the sectors of antimicrobial use in animals. For example, we have AB Register, in which we have the poultry, the pig, the dairy, and the beef sector combined. This is for the Flemish part of Belgium. And in the Walloon part, we also have Bigan, that's another private data collection system, working mostly for the dairy and beef sector. And there is also a private data collection for veal calves, managed by SGS. Next slide, please. But then, so this is sector initiatives, and then we also have the governmental data collection, which serves another purpose, really to then collect the data from all the farmers, but also to report antimicrobial use data to the European level. That is organized by the Medicines Agency, and the system is called Sanitamet. Now, the nice thing of that, what is connecting, let's say, all those systems is the central role of the data analysis unit of AMCRA, because we provide actually the approach for analyzing then the data, a scientific, concerted and uniform approach, you could say, for the analysis of the data, and also for then we do benchmarking of the data, benchmarking of the farmers, of the vets, and we report those data, or we make reports about these data, and then they are provided back to the farmers and the vets by the respective data collection systems. So that is the first dot there. We have the farm level benchmarking reports, of which you see some screenshots, where we really try to provide farm level insights on the antimicrobial use at the farm. Of course, from those data collected at the farm level, we can also have very nice national level results, which are, for example, reported every quarter in what we call the barometer. So it's the Sanitamet barometer. It has grown from a small presentation of I think 10-15 slides. Now we have over 40 slides, but really informative, I think, for all the people involved. And I think it's really something that people really tend to look into. Next slide, please. But then, of course, we also have in Belgium our national report of antimicrobial use, which is called BALVITSAC. It has been founded actually over 15 years ago by Professor Jeroen de Wolf, what some of you might know, with his group, I mean, from the Ghent University, and requested by the National Medicines Agency at the time. So already now we are in 2024 with the last report. If you want, you can go and read it. It's in English. But it will show you, if you consult that report, it will show you, if you show me the next slide as well, it will show you that the results actually with our Belgian approach are really nice. Yeah, of course, the slides was meant to have some animation, but it's not working here. But anyway, you can see here, and that I think if you look at the graphs, and you see everywhere a decreasing trend, and it's really the results of the sales and the use data over the last years in Belgium. So the left graph, which is hidden a little bit, is the sales data, which is really used as the basis for the antimicrobial use policy in animals in Belgium. And you can't see the last result, but actually last year we achieved a decrease of almost 60% compared to 2011, which is, I think, very nice. At the right side of the screen, you have some three smaller graphs which show you more specific data, the use of cholesterol, the use of premixes, and the use of the what we call the red antimicrobials in Belgium, or the antimicrobials with the red color code. It's the fluoroquinolones and the third and fourth generation cephalosporins. And you all see that we have achieved very nice reductions. Of course, when you have the use data, these allow for a much more detailed analysis. So you can see here only one graph, but it shows you the result in the pigs, the poultry, and the veal calf sector. And also there you can see that we have achieved nice reductions. We can zoom out a little bit again. If you go to the next slide, please. My apologies for the structure of the slide has been altered a little bit, I see. But okay, the message I think is clear, and the point is so that in Belgium we have at the basis we had the auto-regulation bottom-up approach, which has evolved through the years to a more co-regulation. But still, AMCRA is always having the lead and by actually drafting what we call visions. And we had the first vision, AMCRA Vision 2020, and we had a second vision 24, and so where we always look ahead a bit and say, okay, these are the targets that we want to achieve in the next 4, 5, 6 years. And so now we have our most recent vision is 2030, and that is then used as the basis, let's say, for other initiatives, of which the two main are the Antibiotics Convention. We have had already 2 Antibiotics Convention where we have both the stakeholders of the sector and the government coming together and explaining and writing down, let's say, each of their initiatives that they want to work on in the next years. And as many other countries, I think we also had a first national action plan on AMR in 2021, I see, and there is also a second one in preparation, and there's also the third Antibiotics Convention is also in preparation. We hope to finalize them next year. But you can also see on the slides that the co-regulation is also part of that is actually that we have now royal decrees, so legal obligations concerning the use of antimicrobials, but also the collection of antimicrobial use data by the veterinarians. So it's really everyone together, a mix of all the stakeholders with their own strengths. Next slide, please. So just to say that our approach, as I've shown you in the data, you could say it at least in terms of AMU and AMR. I'm going to say a very small word about it in the end of the presentation. But in terms of AMU, our approach has been successful. But of course, there are other approaches in other countries. And I just wanted to point you to the acting project, the acting consortium, which AMCRA has been heavily involved in since the start, let's say, the unofficial start in 2015 already, and then really as a project in 2018. And one of the things that we did there was drafting a website, actually, where you can consult the different initiatives that exist in different countries in terms of antimicrobial use data collection. So I think it's really worth of visiting that website. It's acting.org. It should have been on the slide, but it disappeared, I think. And we also have had already 3 international conferences. Maybe next year or one of the coming years we will have a 4th. I don't know. It would be nice. So this is the overview, let's say, at the European level. If you go to the next slide, I just wanted to show you that we are not the only ones, of course, with national reports on antimicrobial use. Recently, I got in my mailbox 2 newsletters, one from the Netherlands, with the mentioning of their publication of their English version of their yearly report, and also from the UK, we had the VARS report 2024. I think it was only 2 weeks ago that I got the news message from that. So there's plenty of information out there if you go looking for it. Next slide, please. Then, of course, we have also the international reports. It has been mentioned before during this workshop, and we have the former SWAC reports and now the ASU report, I think. And also there's, of course, the report from the WOA, also specifically on antimicrobial use. And then, if you go to the next slide, I think it's almost my last. Yeah, of course, as I said, that was a lot about the AMU aspect of the AMR problem, but it's a much broader problem. We have seen plenty of information already about AMR and tackling really the AMR, collecting data of AMR. Of course, in Belgium, we do the same, and it's a real pleasure for me to mention that recently, last week or the week before, our annual BALMAP report has been published. You can consult it through the website, to the link shown there, where we combine information from both the animal sector and then AMU data and AMR data, and the human sector, also AMU data and AMR data, and also environmental data. So it's a huge report. It's a huge effort, a really nice effort, I think. Very interesting, a lot to read, though, but it's certainly worth to take a look into it. And it's actually maybe a little bit the same as the GEOCRA reports that has been mentioned before, but then, of course, there it's at the European level. And with that, I would like to thank you and give back the words to Sander or Bruno. I don't know who's going to.
Yes. Okay, Vanessa, thank you very much. For the data, there's some question there. And when you take the private data and the public data, there's no overlap. Do you use both data? Do you trust them equally? To what extent do you think it's a good idea? Or you only take the public data? How do you do that?
No, well, let's say that there is no overlap. So it's, of course, it's a challenge. It has been sometimes a bit a difficult exercise to have that functioning in the correct way, but I think right now we're doing quite well. Of course, for the national reports, we focus on the national data, but the systems are organized like that the data collected once only needs to be collected that one time. So if there's data collected in one system, a private system, it's transferred to the national data collection system. That is, I think, maybe even one of the strengths of the way we work. It might seem as a weakness, but actually the sectoral data collection systems they allow for a very close contact, let's say, with the farmers, with the vets. They are more trained maybe to do that compared with national government, who is always a little bit organized in a different way. So I think there is not really an issue there. There are still, of course, some points for improvement, but I think that's everywhere the case.
Okay, I agree. I think that there are many private data, also companies on small animals, etc., that we could really talk with them and include them, and instead of doing everything from scratch. So I think it's a good opportunity. Thank you. So I please ask all the speakers to turn on the camera with some questions in the chat. And one of them is very crucial. So we do a lot of efforts in Europe. It's great. Look how we take, but then we import a lot of things, a lot of food, a lot of ingredients, etc. So to what extent is this controlled? To what extent are we not just doing a lot of efforts ourselves, and then everything flows in with a lot of countries where there's less regulation? So what is happening there? How is this happening? Is this an issue or is this not an issue? Please, whoever wants to answer, Jorge, Ernesto. What's going on there, Ernesto? Because we are really, they're super strict, and then sometimes other countries are not. They use growth promoters, whatever. So what happens there? Please enlighten us.
I think that would be a very good question for our risk managers colleagues in Brussels. I think it is true we don't have a full picture of what's going on with imported foods, for example, in Europe. As part of the harmonized surveillance, we have for the last few years data from border control posts, but the data is incomplete. And as you can imagine, it's also very difficult sometimes to sample these big consignments. The sampling schemes for those type of products are always challenging for the member states. There are plans, for example, to embark on new activities, new baseline surveys for aquaculture products, but we receive concrete instructions to do that only for domestic products, not for imported ones. So sometimes the trade barriers issues are real barriers also for acquiring scientific information, unfortunately. Yes, I would agree. That is something when you look at papers, independent papers from researchers, you see that we cannot turn the blind eye on what may be going on with importing fresh produce, aquaculture products that come from regions of the world where the use of antimicrobials is not as regulated as it is in Europe. Yeah.
But isn't it that we oblige the countries that have to export or food to Europe, that they have to follow our rules? Because
Indeed, but the rules, there are no legal microbiological criteria in relation to antimicrobial resistance. So you can impose hygiene criteria based on whatever, Listeria, Salmonella, coliforms, all that, but there's nothing in European law that tells you the maximum allowed level of resistant tetracycline resistant E. coli is X. That does not exist.
Yes, yeah. Well, we've been fighting for that a lot. So how is it possible that you can import things with no Listeria, no E. coli, but the amount of carbapenemase genes there is amazing? So maybe it's much more a public health hazard than not having E. coli or not having Listeria. So I think that genomic surveillance may be something that we could start. Azucena, you said that there was this link between bacteria in food and urinary tract infection. Is this something that is your idea of your lab? Is this universal? Is this regional? How important is that? So do you know what is the weight of it, or is it anecdotic? Or
no, it's not anecdotic, and it's not on my own. This is something that in USA were years ago studying. So this is supported by strong evidence from other scientists. So the only thing is that I bring the attention that not only STEC, for example, talking about E. coli, but we'll see that extraintestinal pathogenic E. coli should be also surveillance, as well as Klebsiella pneumoniae, and also is to bring the attention about in the past we used a lot of compartmentation in terms of bacteria classification, and now we know that this is not like that, especially talking about E. coli. So we cannot label an E. coli like that and see what happens in pig farming, for example. That I think the simple explanation is that we are changing antibiotics in pig farming. We are reducing completely colistin, but we are using neomycin and whatever, and E. coli tox. So moves change, and we can trace this change, and we can know what's going on. So we will witness this emergence of hybrid different risk in the future. So it's not mine. I don't think that this is something that...
No, but it's interesting to know that food can be a primary source of urinary tract infection. That link is not so evident for most of the people.
Because the UTIs, the source of UTIs are our own gut.
Yes, I know. Normally, it's the infection. Yes, it's rectal infection directly. Yeah, exactly.
So it's long to explain. Thank you, Bruno.
Yeah, no, it's okay. Okay, thank you. Jorge, growth promotion still in many countries worldwide. So what can the WHO do? How can we help to try to tackle it? Because this is a primary problem. And what do we do with the United States, where they don't use anymore clinical antibiotics, but they still use antibiotics? So how can we try to... So how can you force? Can you somehow the WHO force countries to stop doing that? Do you think it's really important that we stop that, or also in the context of African countries, while they maybe need food and maybe they should be using it because they need more food in specific regions? So how do we face this?
Thank you. It's very good question, Bruno. We cannot impose. What we do is to provide guidance and follow up and support. Basically, what we work a lot is to build capacity in countries. But it's not just the capacity for lab to identify and also to collect data on use of antimicrobials. It's also to use the information to understand what exactly they are collecting. The MIA, for example, is the guidance from WHO to non-human sector. And when we talk about non-human sector, it's out of the WHO mandate in some way. That's why we established that partnership with GOA and FAO to work together, because they are working directly in the animal health and plant health to really work closely with the country to really ban the use of these antimicrobials in the case of growth promotion. But, I think that the countries are advancing. They are building capacity. You can see some difference now, because if you see the report that I showed, the results of the use of antimicrobials in animals, that is changing, because at this stage, it's still the reporting is by region. It's not by country. Why? Because countries are still with the problem to share data that can have some trade implications, right? So in that case, now countries are more aware about what they have, how to address the problem, and in the coming reports, we are going to see already reports by country. It's not a lot of countries, but at least it's the first step to really see what exactly and which country is using antimicrobials for growth promotion. So that can help us to identify and prioritize these countries, to work with them to do better responsible use of antimicrobials.
Yeah, thank you. So you talked about reduction of antibiotic use in general in Europe, and also Vanessa said that. But Ernesto, we are reducing antibiotic use in animals, and we have suddenly the scabapenem emergence in animals. I mean, this is the most threatening, from my view, the most threatening thing ever happened in the food safety in the last year. So what happens there? How is it possible that without using carbapenems, suddenly farms have carbapenem-resistant enterobacteria in Norway? In Norway, with this problem, it's very difficult to find the carbapenems in the human population, and now suddenly you have farms. So please try to help. How do you think that we can tackle this? And also, once you find it, what do? You sacrifice the animals. You forbid the selling that food. And in the cases also, because I have many questions, because this is a public health issue. And also, once you have found it, it disappears alone, or it stays, or it spreads. So please tell us a bit more, because I think that this is one very important threat that we have in Europe. And also I have the question, sorry, if this is only the case in Europe, or if you've also found it in Southeast Asia, or in Asia, or in Americas, please.
Yeah, I think how many hours do you give me for an answer?
You have a few minutes. No, but you're smart. Synthesize it.
As you rightly said, how can this happen in countries that they have such a restrictive policy on antimicrobial use in animals, and more so with substances that have never been used in animals, at least that we know of, or legally? And I think the answer is quite logical. Everything is interconnected. Humans do not live in a bubble, and there is a high risk when there is an imbalance of prevalence in a certain compartment. It's a no-brainer to think that effluents from hospitals may contaminate water courses that may then be used to water our plants, or you may have workers in farms that may come from environments where they are exposed to such bacteria. We know, if you look at the reports from ECDC, that this type of microorganisms are growing rapidly in the community, not only in the hospitals. So we have a high suspicion that this may be a spillover from the human compartment. And we hope all these EPI studies will shed some light on this. Although it's difficult to conduct such studies because sampling of humans is not that easy, healthy humans. I mean, so it's a complication. The second question is what to do about it. I think the first thing you have to do is to have a contingency plan. You don't have to wait until you have the problem, because then it's too late. Everybody gets nervous, nobody knows what to do. And there are several good examples of countries that were proactive and had already on the table potential measures. There's no hard law about it. There's nothing you can do to impose to a farmer, sacrifice your animals. But I think with dialogue with them, explaining the situation, and there are certain things that can be at least tried. There is not a lot of hard evidence of what works or what does not work. And for some of us that have a certain age, is very reminiscent of what happened with ESBLs and with CTXNs 20 years ago. Nothing was done at the time, and we are in the situation we are in today. You don't need to use carbapenems in animals to select for CPs in animals. You just need another co-located gene of resistance to something very commonly used, and then this would turn out to be a huge problem. So I think our project will give some results. We will do some comparative genomics with human strains that may shed some light, and I think this would put pressure also in risk managers to start thinking seriously about what to do here. So right now, a disclaimer, this seems to be a mainly humanly driven problem. That is undeniable. But as soon as this crosses over to another compartment, then the situation may completely change. Thank you.
Mm-hmm. Yes, they appear probably because of cross-selection, no? Because there's probably something, you're giving something to the animals, or you're not giving them carbapenems, because in Europe we only have intravenous carbapenems, but something that is in the plasmid or for the bacterium, it's good to have, so it's cross-selection of something, no? It can be even something of the food or something. But no, that's extremely interesting. And just to finish, we have not talked about innovations and possibilities. Thank you, Heise, we have to finish. But about innovations, what happens? Can we do something? What happens with phages? I have some friends there in northern Spain, in Bilbao. Hello, the people from ASTI. Can we have some innovations, use of phages in food? Can we do something with the primary production? Difficult to do, some things to do, as Ernesto said, what do we do? Contingency plans. But can we do something in food to avoid the transmission, and then food would be a bit safer? Is there innovations that we can use maybe to help to everything is happening in animals, is difficult to control there? Can we do something in food, on food production, or food technology, or using alternatives maybe to block these transmissions?
Is that aimed to me or in general?
Whoever.
There is of course some hope and promise on alternative to products to antimicrobials. Phages maybe one. I think it's rather difficult to think that you would have the phage which is specific for a particular resistant microorganisms. I think it does not work that way, but we have started already receiving applications on phages to decontaminate against listeria, for example, or food additives, phages which are used for controlling salmonella and things like that. I think the major problem we have in that respect is the regulatory context. It's so difficult for the private companies to bring the products to the market because of the unclarity and difficulty of all they have to endure to get their product authorized. That I think that's the first step that is blocking innovation. But phages is just one of the many examples. I think there are other things, feeding strategies, fecal transplants, as well as the more traditional husbandry improvements, etc., etc. So yes, there's a lot to do also in the alternatives front. Thank you.
Okay. So, it was really a super pleasure to have you all here. It was really super fast. Now I would like to stay much longer with you, but I think it's good that nearly everybody that started to be with us today stayed until the end. So I think it's good that we were short. So thank you for your conciseness, for giving us the time. Wanted to thank for Una Europa and IFA also for having this opportunity to put these two important networks together. I think it's the first one, but we will do probably more webinars together. So Hassal, the floor is yours. Thank you.
Well, thank you very much for everyone, to the speakers, Ernesto, Jorge, Juanes, and Azucena, for sharing your expertise with us, to Bruno for guiding the discussion, and to everybody, joining and contributing through questions. And as I said before, if you want to rewatch or share this webinar, the recording will be on our website in a few days. And if you're interested in this topic, you might want to consider joining one of the stakeholder networks that IFA hosts. We have the AMR Stakeholder Network and the One Health in Action networks. If you're interested, just check our website or get in touch with us directly. And that's all. We appreciate your time and engagement, and we look forward to seeing you in future events. Thank you very much.
Thank you.
Excellent.
Thank you.
Thank you.
Thank you. Bye.
Thanks to all, and also to all the people with us. Thank you. Bye-bye.